With the winter storm comes the chore of shoveling and being out in the cold. So we're bringing in our 9 News health medical expert, cardiologist Dr. Pyle Coley, to talk about how to protect yourself when you're out shoveling. We were talking about this earlier. I can't believe that this is something where you see people really could hurt themselves or even have a heart attack. Why does that happen?
Yeah, very much so. The American Heart Association says that shoveling is one of the most strenuous things that you'll do for your heart. And in fact, multiple studies have linked it not just to heart attacks, but also to sudden cardiac arrest, where the heart can suddenly stop and you can drop dead. So it really is, if you think about all the combination of factors going into what's happening when you're shoveling, you're doing something very physically strenuous, right? So your heart needs more blood. The cold weather makes the blood vessels that supply blood to your heart constrict. The cold weather makes the airways constrict, so less oxygen is able to get in. And on top of it all, you might be holding your breath and you might be a little out of shape. These are people who are not normally doing this kind of level of activity who go out there and shovel. So putting it all together, you can really set yourself for a heart attack.
Especially this first time too. We haven't shoveled in months, right? We haven't been out there.
We haven't.
Let's talk about some of the other things. What can this do to what's happening with your lungs, your blood pressure? Talk about some of the other things.
So it's not just about people who have, going out there doing something strenuous. If you have high blood pressure or other pre-existing medical problems, you should probably not be going out and shoveling. And that includes problems like asthma. People have diabetes because it can affect your circulation. People have high blood pressure because going outside the cold weather can raise your blood pressure. People who have kidney disease, people who have neurological conditions like Parkinson's. These are all people who should not be shoveling because the cold outside can really exacerbate it. Now, the dryness can also make things a lot worse as well because it can dehydrate you. So a lot of people, when they're shoveling, start to feel dizzy or lightheaded, and they're probably also hyperventilating because, again, that level of activity is a little bit higher. So they're changing the levels of carbon dioxide in their blood as well. So lots of things going on with your body that you don't realize, and a lot of us get up off the couch, walk outside, and start shoveling. And in fact, in medical school, the first picture that they showed us of a heart attack was a man leaving a bar carrying something heavy with the snow blowing in his face. And that was kind of the classic, perfect storm to trigger a heart attack in someone, because you've got dryness, you've got coldness, you've got inflammation, you've got strenuous activity, and it's just can be very risky.
Well, and it makes perfect sense when you think about it, because you always say you don't want to work out outdoors in these conditions, and shoveling snow is like a workout. You can sweat under those clothes and, you're going hard. So how do we optimize our health and make sure that we're safe if we do indeed have to go out and do the chore?
Yeah, so it's a workout. So what do we do before we work out? We warm up. So what I suggest to patients, if you are going to have to go out and lift that snow, especially this heavy snow that we've been talking about that we're getting, then you want to make sure that you warm up inside before you do so. You want to make sure you really have a good gauge on how you're feeling as you're doing it. So if you're starting to feel any symptoms at all, whether it's heavy breathing, I heard Steve Steger huffing and puffing up that hill, right? I was like, I think he needs a break. So anything like that, you need to go time out, go inside, warm up, drink some water, because when you're breathing like that, you're breathing off a lot of water really, really quickly, and take frequent breaks, and don't tackle that whole driveway at once. With the kind of snow that we're getting that's really heavy and so many inches, if you try to lift that, not only are you going to cause cardiovascular respiratory problems, you could injure your back, you could fall, you could slip. So you really have to be really sort of strategic in how you tackle that driveway, or pay one of the neighborhood kids to come and shovel the driveway.
There you
just
go.
Don't do it.
Then you both win.
Yeah.
Thank you so much, Dr. Coley. We always appreciate it. And if you would like to see more with Dr. Coley, just head to 9news.com/Dr. Coley.